Good evening, ladies and gentlemen. Thank you for joining us for tonight's edition of HR Mentorship Learning Series. Tonight, we are very privileged to have one of the leaders in the HR sector and also in the healthcare sector in our midst. Our facilitator tonight, I'm tempted to say doctor, is Mrs. Oladotun Adeogun. She's the Managing Director of Hallmark HMO. And she'll be speaking to us on the topic, role of HR in providing access to HMO as a tool for employee well-being, the role of human resources in providing access to health management organization as a tool for employee well-being. I would like to read a profile so that we can get better acquainted with her and pay better attention. Ladies and gentlemen, Mrs. Adeogun started her working career with an audit firm before delving into people management practice. She worked in the capacity of human resource management and administration with Linkserv Limited and Financial Institution Training Center, FITC, before joining the insurance industry. She's a C-suite executive with over 15 years human resources and general administration expertise, with a track record of successfully executing major projects, among which was playing a key role in the merger and acquisition of the consolidated Hallmark Insurance PLC during the 2007 insurance industry recapitalization. She's an accomplished HR generalist and has experience setting up the HR policy and processes, and she has also championed cultural reorientation. Mrs. Adeogun moved to the role of Managing Director of Hallmark Health Insurance about 6 years now, and she has successfully positioned the company to another level. Through our leadership, the HMO hosted industry leaders for an annual stakeholders engagement, which focuses on how healthcare can be enhanced in Nigeria. She's a fellow of the Chartered Institute of Personnel Management of Nigeria and a member of the Society for Human Resource Management. She was one of the Stream 1 mentee of the Whisker mentoring program. Ever since, she has also mentored several ladies in human resources and career in general. She has acquired several relevant certifications and training programs to enhance her competencies, among which include the SHRM SCP. She's also an alumni of the prestigious Lagos Business School. She did the Advanced Management Program, and she was in the batch 26. Ladies and gentlemen, she has also mentored many MBA students from her alma mater, Lagos Business School, and assisted and supported them to redefine their career goals. Oladotun has facilitated several sessions on human resources and leadership at various groups and associations. She sits on the board of some firms, including CBHR Consulting Services. For the first time, ladies and gentlemen, let's welcome Mrs. Oladotun Adeogun. You have the floor, ma'am. Thank you for joining us.
Thank you very much, Dr. Adeosun, for the warm introduction, and good evening to everyone. So I will go right into this presentation. I actually had a mix of, ideas in terms of, am I going to focus on HR or health insurance? And I felt like it's possible to combine the two because between you and I was managing HR just like you and managing HMOs before I stepped into this role of managing director of the HMO. So we'll be looking at what well-being means. We'll be looking at who is responsible for ensuring well-being. We'll also look at the wellness wheel. We'll talk about the benefits of HMO, the limitations, what is the government's role, how is HMO practice or health insurance practice outside the country, and what is the role of HR in health systems for their employees, and how do we consider playing fair to all concerned. And then the regulatory compliance, business case for employee well-being, which we can all use to meet demands for providing healthcare. And then what is unique about Hallmark HMO. So the definitions I have 3 definitions, one from dictionary as well as from WHO. It says that well-being is a state of feeling health and happy. You feel healthy and you feel happy. Health is a state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity. So it's not only the fact that the person does not have any ailments, but that physically, mentally, socially, the person feels very well. And then WHO also said, well-being is a positive state experienced by individuals and societies. Similar to health, it is a resource for daily life and is determined by social, economic, and environmental conditions. Well-being encompasses quality of life and the ability of people and societies to contribute to the world with a sense of meaning and purpose. So it's more or less saying that it's at the center of your existence. Your well-being is very important. And you have individuals coming into your organization, working with you, who are members of the society, who, through the job that they are doing, they contribute to the economic well-being of the society and environmental conditions. So the need for you to look at their well-being and plan, the best approach to giving them the best. How well can you provide the well-being that they need? How well can you support them in giving them a better, healthy lifestyle? And there were other definitions or expressions of what well-being is. And this is from the Office of the National Statistics. They developed a report on well-being in the UK, and they mentioned some words. I'm sure you can see the words here. This is like a diagram of the words: belief, community, control, education, employment, equality, family, government. Health seems to be like the highest in terms of, the size compared to others, but they are all interrelated and they all have a role to play. So who is responsible for providing healthcare? Is it the organization? Is it the individual? Is it the government? It's a gamut of everybody involved. The UK government developed the documents on UK health systems, and it's instructive to know that other aspects of well-being alongside personal well-being were also, in that document. To make you, to say that somebody has a good well-being, the person's relationship is involved, the person's health is involved, what the person is doing is involved, where the person lives, then personal finance, education and skill, the economy, governments, and then the natural environment all contribute to making somebody say, oh, I have a good well-being. I understand my environment and it's supporting me in seeking the best that I can be in terms of education, in terms of skill. It's helping me to develop the personal finance that I need to live the life I want to live and to do what I want to do. So when you are relating with human beings who are your employees, you're relating with people with multifaceted, life. They live in an environment. We are all governed by the same, at least for those of us who are in Nigeria, we're going through a particular issue right now regarding governance and economy. Our relationships, how we relate to one another, helps to form, the responsibility around well-being. All of this. So the employee is at the center of it. You, as the HR, the organization, the environment where the employee lives, how the employee is managing their personal finance, what level of education and skills the employee has, all contribute to determining the person's well-being. This is a wellness wheel that was developed by Rizwell, a wellness IT firm. And you can see from this circle, you have 8 wellness areas: emotional wellness, spiritual wellness, intellectual wellness, physical wellness, environmental wellness, financial wellness, occupational wellness, and social wellness. I'm sure you know that your HMO cannot provide all this. So you as an HR knows that your job goes beyond just, I have secured an HMO and that is it. No. How well are these people connecting in all these areas of wellness? And, the definitions for each of these wellness is also provided here. So for an HMO, what does an HMO do? HMO means Health Maintenance Organization. And they are private organizations that provide managed care services to its clients by offering them access to healthcare after paying a premium. So HMOs actually are organizations set up to make profits. They are not government establishments. Government also has, government is obviously the regulator, but government also provides HMO, healthcare services, through NHIA, through state schemes. That is also possible. But the HMOs are the private ones that are also doing this. Now, the difference between government providing healthcare services and private is that for private, we are competing. We want to give optimal service. Government own is based on the plan that they have. You may not even have to interface with anybody from the time you buy to the time you go to the hospital and all that. And ordinarily, their own is obviously going to be cheaper. But in terms of what it covers, it definitely will not cover much. And it's compulsory for government workers before now. But due to the new act, the government HMO or government financing is now said to be compulsory. However, in spite of the act, operationalizing the act is still an issue. There was a guideline that was released for HMOs to run with, but there were a lot of challenges with that guideline. And right now, there's a new leadership at the NHIA, and they are looking at it, reviewing it. We've had some engagements with them, but we've not finalized on that. I just want to mention a bit of, what an HMO does, providing healthcare services by you buying into their plans and then giving access to your staff. Before HMOs, at least I have practiced this before, retainership with hospitals. You identify few hospitals in key areas and you go into an agreement with them to handle the healthcare needs of your staff. You can even have a form whereby your staff will fill the form before they go to the hospital. You can all tell me, I'm sure you are aware that that was not a very effective way of managing people's healthcare because you have very few hospitals. That means if I'm living in a far place and I have a need to go to the hospital, I'll have to drive down there. So when it comes to emergency, that retainership doesn't work. And there's another problem we discovered with retainership, that at times, employees can collude with the hospital to falsify bills and then bring the bill or go back to the hospital to get paid for it. Other times, hospitals overbill because retainership is like a guaranteed income to them. The second thing that happens is medical allowances are paid. So in your salary, there is a portion for medical allowance, and that is paid to you. Some organizations will say, you bring your bill, we'll reimburse you based on the limit of your medical allowance. However, some are very generous. And the flaw for this system was also that people will bring spurious bills. Whenever they need cash, they will just bring spurious bills. Medical allowance is good, but you and I know that when you have cash or you have money, you can deploy it into whatever areas you need. So you may not even go into medical. If people use this medical allowance to buy themselves health insurance, perfect, but that doesn't happen. And medical allowance, whatever the sum, compared to premium that is paid and then gives you access to more benefits, is obviously not going to be the same in terms of value. Reimbursement for medical bills also occur. That also may have its own challenge. I may not want to disclose my medical challenges to the organization. So when I bring my reimbursement, everybody sees what the medical issue was. So it becomes a matter of hiding, pretending, and not being upfront with their medical issues. Then there is the aspect of discretion of management. Management can decide, depending on who is involved, what the issue is, to pay or to bear responsibility of people's medical challenges. Some of these practices are still ongoing right now. Some organizations will still tell you, we do not use an HMO. This is what we do, and it works for us. But if you have one-on-one with staff of those organizations, If you conduct employee satisfaction survey, you will know that this is not good enough for them because of the limitations that they have. Does it mean HMOs does not have limitations? No, HMOs do have limitations, but it has a wider reach. And by the time we go through this presentation, you see that this is the way to go. This is how other clients handle healthcare needs of their staff. This is how we provide wellness for our staff in other climes. So Nigeria cannot be left behind. We can't still be going the way of the old days. Oh, we'll be having retainership with few hospitals and that is it. So benefits of an HMO, again, you pay a premium, which is a fraction of the benefits you cover. So we have plans as low as 30,000, 35,000, and it gives you benefits of up to 500, 600,000, and so those benefits are in different categories. You have outpatient care, which is where you go to the hospital to see a doctor, they give you drugs and you go home. You have inpatient care whereby you have to be on admission. You'll be either taking drip or whatever. Then investigations, you go for it, you make a complaint and then the doctor says, do this test, do that test. And then you need to see a specialist. So after you see the general practitioner, he asks you to see a specialist for a particular issue. So each of the benefits or each of the plans that we have has cover for all of these areas. So it's the reason why HMOs function the way they do is that they consider the need for employees, for people who access it, to have, it's just like the only difference is that when you get there, you're not paying cash, but you should be able to have access. Primary care providers play the role of the gatekeeper. So you have what you call primary care provider. That's the first hospital that you use as your regular. You have some that we call secondary care provider. Those are specialist cares. Maybe a gynae or a dental, an optical, an orthopedic doctor, those are specialists. So they are like secondary care. But primary care is your first primary hospital you pick. So you live in Surulere, you pick a hospital in Surulere, and that's where you go. However, it's possible that you want to roam, so you want to have the access to other hospitals. Maybe you have a child that is sick, so you want to access a pediatric hospital. That is also possible. And then you also have diagnosis centers. You agree with me that if you are running a retainership, you may not have access to all this. So it gives you more options. HMOs also provide financial predictability for both employers and employees. We run a budget. Beginning of the year as HR, you come up with your budget based on your expenses of last year, how many employees you are going to have, and because of that, this is the amount of premium you are going to pay. So you're able to work within a budget. But, they say, once you pay your premium, that is it. There might be things that are not covered because of the plan you have. So I always advocate that in spite of the fact that you have an HMO, there should be a budget for out-of-pocket expenses, for cases whereby you need to intervene when an employee comes to say, I need to do this, it's not covered. The reason why you do that and why that is better for you is that instead of buying a very high premium plan for everybody, you buy something reasonable. And then when you have cases, which will not be every time, when you have cases of people that need to access more, you now deploy your contingency budget or contingency fund for that. HMOs also run health talks or education programs aimed at promoting healthy living among enrollees. You find out that you conduct some tests or you review results, usage of, HMO for a particular set of workers in an organization, and you discover a prevalent disease amongst them, then you will be able to go back there to say, hey, there's a problem with your water here. There's a problem with your, the food you eat here. It's giving you and your people so and so. So you do a mitigation and then you do a preventive. That's the advantage of an HMO. HMOs also provide access to a network of healthcare providers across the country. You have the cases of people whose family are in a different state. They live in, they work in Lagos. Their family is based in Oyo State, is in Akwa Ibom or whatever. You pick the hospital for them. You are using a particular hospital. They are using another hospital in another place, in another part of the country. Then there are value-added services, telemedicine, pharmacy networks, mobile apps, that you don't charge additional for. Those are benefits of HMO, even gyms, spa, and all that. But there are limitations for every policy, every beautiful and wonderful thing. There are always limitations, and this is where I need HRs to please be reasonable. HMO is health insurance, so there is always a limit of cover based on the plan. I have several feedbacks back and forth with HRs who will tell you this thing must be covered, my staff must have everything. You are your employee advocate, but you are also going to balance it because we're also running a business. Approval for care can be delayed at hospitals for various reasons, not only because the HMO does not know what they're doing. We run a 24 hours call center, meaning there is always somebody there to pick calls. But in spite of that, we are in Nigeria. At times, network cuts off and you are not able to make the call. At times, the hospital says, I will send the mail, but they've not actually sent the mail. So, or they want to do an investigation, but the diagnosis does not support it. So many things could happen. Or the hospital could have a large number of patients. If you are a walk-in patient, you will still wait. So how does an HMO have the magic wand to change things? So despite the benefits, there's still a need for a lot of public awareness and understanding of how HMOs operate. Because we've observed that, understanding of how HMO operates is still very low. Very low. I said HMO is an health insurance, meaning that we cover a risk. But at times, you find out that the risk has already manifested or materialized before you come to say you are buying the health insurance. E.g., you are pregnant already and you want to buy a pregnancy plan. The pregnancy is already there. So there's no probability again. It's already obvious that, hey, I'm going to pay this claim. So there's no point in doing that insurance again. And people don't understand that, Or you have a pre-existing condition, you are treating some things that you need to take drugs regularly. The way I would price your own plan or price your own premium is going to be different from a walking patient who does not have any issues, no pre-existing condition. The quality of healthcare services can vary across different providers. HMOs cannot own all hospitals. I know that some of our competitors have hospitals, but how many hospitals can one HMO own? On my list of providers, we have over 1,000 providers because you want to have reached for every state, every locality, so that as people, you work in organizations where you have staff in very remote areas and they want to have access to healthcare too. They should have access, otherwise there's no equality. But the truth of the matter is that the provider in one area may not have the best service for you. And you complain and think that it's the HMO. There is no way the HMO can resolve all health issues for you. The most important thing is that if you're having challenge with your primary provider, maybe you need to look for another one, even if it is not near where you stay. Because if you are paying cash, you will drive there. You just need the one close to you for emergencies. So you may experience substandard care because of the level of, development in that region or the facilities themselves. HMO plans may also exclude coverage for certain treatments because it is an insurance policy. It cannot cover everything. So when you have somebody who has those conditions and it comes up, we have an SLA we sign with all our clients, but you can be sure that it's not everybody that reads it. So when there's an issue, it becomes, why is this not covered? Why can we not do this? Now, what's the role of government? Government is supposed to be our regulator to regulate our quality service to our to our clients, providers, as well as those who buy the health insurance policies from us. So the NHI is our regulator, and they regulate by giving us license, by ensuring that we maintain standards and we comply with, the rules regarding quality and all that. Now, as I mentioned before, I said there's a new act, and the new act is supposed to give access to vulnerable groups, to ensure that all the people who ordinarily cannot afford it will have access to healthcare. They also, help to, the new act also talks about improved healthcare standards by regulating both private and public health insurance providers. They want to ensure that Nigerians receive at least the best care that meets a minimum quality standards. And they also are looking at reduction in out-of-pocket expenditure. Now, health insurance is compulsory. And what it means is that everybody should have the basic government prescribed health plan. However, operationalizing it, as I said before, is the issue. So private health insurance is supposed to be like complementary or supplementary, like a third party. A government owned is like a third party insurance for a car, and then comprehensive becomes your choice. However, implementing it is the issue. It's supposed to be bought through the state schemes. Different states have different plans. Government plan is different from state plan. Private plan is different from government plan. So merging all this together to have something uniform, at least as a basis, is an issue for us, which we've not been able to agree on. And that is where we are. But the role of government is very, very valid in terms of funding, in terms of providing standards to maintain. So how does it work in other clients? In UK, they have an NHS, which everybody pays for, it's compulsory. You must, as long as you're a resident, it is paid for through tax and contributions. And it covers range of, normal general services, general practitioner, hospital visits, emergency, and all that. There are also private insurance providers in UK. It's just that they are more expensive. And, it allows for people to have faster access compared to NHS. A lot of people complain that the waiting period for NHS before you get appointments is long, but NHS is like the major employer of labor in UK. So it is working, and we also have to embrace that. In US, you have a mix. The public programs are Medicare, Medicaid, and then Children's Health Insurance Program. But you also have private health schemes. And you and I know, in the US, this is a major determinant of election results. Your posture, how you are addressing healthcare, policies is a major determinant there. So it's government-driven, and it helps people to take their decision, because healthcare in US is very expensive. I mean, for working patients, it's very expensive. People dare not go in and say they're paying cash. Maybe foreigners, tourists, but for the people resident there, they would rather buy a health plan. And even the health plan is not cheap. Ghana is like, very similar to Nigeria in terms of governance and all that. So they also have an NHIS, which was introduced in 2003. It's working better than what we have here. It's funded through multiple sources, including payroll taxes, contributions from formal and informal sector, and then government subsidies. And it also covers a wide range of, services, outpatient care, inpatient, and all that. And it's also, enrollment is voluntary, okay, unlike what we are having now here in Nigeria. But for some certain groups, the vulnerable and all that, it's, they're exempt from paying premiums. They've also faced challenges in terms of funding, sustainability, efficiency, delay in claims payments, but they are moving on. Every system, it requires improvement. Kenya is another country that we looked at, and we felt that, okay, We can borrow some of their policies in terms of how they run their own. It's a state-run health insurance program. So initially, just like Nigeria, formal sector employees, but they've expanded it to informal sector workers, self-employed and all that. The coverage, same, surgeries, maternal care, chronic diseases, depending on membership category. Access enrollment is mandatory for formal sector employees. Informal sectors and self-employed can join voluntarily by paying a fixed monthly. Despite its expansion, many Kenyans, particularly in rural areas, continue to rely on out-of-pocket. So the struggle is moving people from out-of-pocket to subscribe to health insurance. And they've also complained that the coverage is inadequate, limited access to quality and all that. So from all these areas, how it's operating outside Nigeria, how we are operating it, there's room for improvement. We just all have to have an open mind about it. But it is not at the point that we say, let's jettison it and then move into other ways of, managing our healthcare needs. HR as an advocate, your role as an HR is to shape and to maintain workplace environment. You are to act as the architect of your employees' well-being. Your role goes beyond the traditional administrative duties. It involves development of a healthy and supportive work culture. You must understand a bit about health-related issues because it affects your employees. You must have some basic, like a first aid in the office. You must have some basic understanding of, okay, if this happens, what do we do? Even if you cannot do CPR, you must be able to have an hospital near enough, to take people to. In this critical position, HR, you can influence not only the physical, but also the psychological and emotional health of your employees by engaging them, by communicating with them, by reviewing, reports from your HMO based on the outcome of usage over a period of time. You need to also educate your employees on the plans that you have. You need to, go through the plan, know what is covered, know what is not covered. Because a lot of times expectations are very high. But you bought a low premium plan. How do you expect to have access to so-and-so hospital on the island? It doesn't match. So HRs must understand the needs of the employees regarding their well-being and make a commitment to address it within the confines of the business structure. So your organization, you must work within what your organization can afford. You can't propose something that they cannot run with or the budget cannot take, At times, you may have to review your policies. When you're looking at employee well-being, you may have to review the culture. You may have to look at people who are highly demanding and situate their own problem different from others. Because when you are working with a group of people, you will definitely have those who are high demand in terms of health needs. Some are always complaining in terms of, different ways. Learn each of these variations and, look for how to help people to understand themselves better and understand their health needs. Now, I said fairness to all concerned. Fairness because we are not helping each other. HRs and HMOs need to be on the same page, but it's always like we are not. I know you have budget constraints. You have budget constraints. However, we all know that things are getting expensive and expensive. So if you're on a premium and you've been paying the same premium for 3 years, how do you expect the HMO to survive? Or you are one of those that change HMO every year. You just keep changing from one to the other. So you keep negotiating. It's all about how much am I paying? No, it should go beyond that. The well-being of the employee should go beyond budget, just numbers. Because if you look at just the number without looking at the benefits you are getting, you are not fair to all concerned. And then also consider the health complexities. As I said, some people are more, they have health challenges more than others. So those ones, you need to isolate them. Don't put them in the general pool, and address their own health needs differently from those who are generic users. Some may not even go to the hospital in a year. And I've also had those complaints. I've not used the hospital. I've not used my HMO for 1 year. Why are you deducting my money for those who deduct the money from the employee's salary? The truth of the matter is that it's a pool of funds. You didn't use it this year. God forbid you may need it next year. If you have kids and you say you don't need an HMO, wow, I really wonder. Because in their growing years, there will always be one emergency or the other. Not because they deliberately want to create emergency, but because as children, they will explore. They will swallow what they should not swallow. They will, be in one form of injury or the other, and they need healthcare. So review the health complexities and appropriately deal with it rather than making it a routine, just HMO for everybody. Competition and sharp practice is another thing that happens in the HMO industry, which we in human resources are the center of it. So you've been using an HMO for 1 year. They came back to you to tell you that it was not profitable for them. Doesn't matter to you. You tell them to take a walk. You get the next one. The next one uses it. It's not profitable for him. Take a walk. You get the next one. Very soon, I don't know how you think that will play out. But for me, I think that you need to be more considerate. The truth of the matter is that why don't you look inwards? If every year, every HMO keeps complaining about your employees' access, what you should do is to go back and have a review. Otherwise, we are not fair to all concerned. And if you think that, oh, it doesn't matter, we're just buying it off the shelf. Very soon, HMOs will also not want to partner with you because it's a contract, it's a two-way thing, So let's be fair to all concerned. Let's consider the fact that things are becoming more expensive. Let's review our budgets for healthcare needs. Solution to the challenges that we've all talked about. Review data of utilization for your staff. By the time you go through the list, it's confidential. They will share it with you. They will share the details. You will know who or which area you need to tweak. And as I said, there are some people that you cannot put on the general HMO plan because of their own health needs. So those ones, make a presentation to your management for a review of some sort or to move them to a different plan so that they don't keep giving you a negative utilization report for those people. It could just be one case of one major surgery. Then that's just a spike. It doesn't mean that it's going to continue like that. Have that conversation with your HMO. When you have those, by so doing, what the major health challenges with the assistance of the HMO, you plan a mitigation plan, you do training for your staff, and you educate them properly. Everybody wants to be healthy, so it's just a matter of intervention, how well you're able to pass out the message, how well the people trust you in terms of your assistance, to say, okay, I don't mind your assistance, I'm willing to consider it. You may have other challenges that you may have observed. You can drop it in the chat room, we can talk about it. I'm just raising the ones I have dealt with. It may also involve creating a preventive healthcare plan for such staff, So for some, they just need to work with a dietitian to help them in some areas. For some, they need to watch their cholesterol over a period of time. Some, they need to change maybe their work time just because they have to take drugs in the morning and then come, resume a bit later than others. There is no one size fits all when it comes to healthcare. I'm sure you know that. There is no one size fits all. What makes you outstanding as an HR is to rise up to the occasion to say, how do we deal with this? Don't do generics. I think I've mentioned that over and over again. Let each case be taken on its own merits. And when you think that management will not listen, it depends on how it's presented. It depends on how it's presented. defend the need for review of premium based on facts. And the facts are very clear. The drugs are getting more expensive. Dollar rates are high. So importing drugs is not the same as before. So when your employee comes to complain, I want this particular brand, the HMO said I can't have it. Ask the HMO, how much is this brand? What are the alternative brands? How much is that? And then make that, let that enrollee know that, why don't you take this brand? It will equally work. It doesn't mean they don't like you. It doesn't mean they don't want to give you. Or do you want to pay the additional? They will pay the cost of the drugs to this level. Do you want to pay the additional? These are practical ways of reviewing things. Then you need to also make a justification for review as much as reasonable without compromising quality. Quality will be compromised if you keep jumping from one HMO to the other, year in, year out. Hold regular sessions with your staff, invite the HMO, deliberate on issues, complaints, and resolve it. Complaints will happen. What happened? How can you resolve it? How can you improve on service delivery? Have those engagements. Don't dump them because of 1, 2 complaints. Yeah, they don't respond to calls. Oh, they don't do this. Oh, they don't do that. At times, your employees may be exaggerating. I'm not saying that there are no complaints with HMOs. I'm not saying that. But at times, your enrollees may be exaggerating. We've had cases of getting to the hospital, the enrollee said they did not attend to me. They got to the hospital, the enrollee was there, he had his drugs, he had everything. And we were like, why are you escalating what is not? Now call your HR now, and tell her that you've had access, you've gotten your drugs. So at times they can escalate things for no reason. Oh, they want you to deliver drugs at home. So they get to the gate and they call your staff. He doesn't pick. The dispatch rider is there waiting. How are we going to handle that? So what do? We go back, we would have paid for that dispatch rider. And when they complain to you, you are not asking questions. The only thing you say is, HMO, just go and deliver. I don't care how you do it, or else I'll remove you from this. That's not fair. So compliance with regulation is the issue. And here we are, NHIS says, they want to do this, but Lagos State is also coming up with enforcing it. Right now, there is an executive order signed by the governor of Lagos State. However, we are having conversations. We've discussed, we've agreed that we need to work together, HMO and LASHMA and Ministry of Health. However, the modalities around it, we have not concluded it. But they've gone as far as telling us that, look, we know that we need to partner with you. For companies that already have HMOs that are registered with LASHMA, we will allow it. But the modalities have not been concluded. So no need to say, oh, we're going to jump out of our private scheme to go and buy LASHMA scheme. You can buy LASHMA because you want to buy LASHMA, if that is your plan, and that's within your budget. But if you prefer the health insurance, the private health insurance schemes, you can do that. Once we are done with the conversations with Lagos State, I'm sure that we would send out a circular around it for Lagos-based staff. And for other states too, whatever is done with Lagos State will become a template for them, because Lagos is a flagship state. Business case to support overall well-being. These are research outcomes, which speaks to the fact that health outcomes come from taking specific, decisions regarding healthcare. American Journal of Health Promotion said they published a study showing that employees with multiple health risk factors, such as smoking, high blood pressure, obesity, are less productive than those with fewer or no risk factors. This study concluded that during reducing health risk among the employees could lead to significant gains in productivity. So when you identify this as an issue for your employee, it's a matter of engaging the employee and working with the employee to reduce the health risks that these things may cause. Journal of Occupational Health Psychology research highlights the importance of workplace mental health programs. Mental health is an issue. In Nigeria, we think that it's not. It is an issue. And HMOs have partnership with specific providers who focus on mental health. So workers who have access to mental health resources and support are better equipped to handle stress and recover from setbacks. We all need to have these kind of programs so that it can help us to handle stress, especially in Nigeria. Wellbeing is associated with 19% reduction in all-cause mortality in healthy populations. This is UK Department of Health. So the better that we are in regarding our well-being, it will reduce rate of mortality. Another one is productivity outcomes. Gallup State of America Workplace Reports said that employees who are engaged and have a high sense of well-being are 21% more productive than those who are not. Gallup's research indicates that well-being initiatives that encompass physical, emotional, financial health helps employees to be more engaged and productive. That's why HR is involved in this. SHRM says that creating a healthy work environment, which includes ergonomic workplaces, healthy food options, and support for work-life balances, enhances employee productivity. Employees who feel physically comfortable and supported at work are more likely to perform at their best. Reduce absenteeism. Journal of Occupational and Environmental Medicine, a study showed that poor employee well-being is associated with high rates of absenteeism and presenteeism, being at work but not fully functioning due to health issues. Employees with higher well-being takes fewer sick days and are more present and engaged at work. Reduce absenteeism. So when you focus on employees' well-being, is to reduce absenteeism. WHO estimates that depression and anxiety alone cost the global economy 1 trillion a year in lost productivity. This highlights the economic impact of poor mental health on businesses. So, I mean, if people are depressed, they are anxious, they can't function, they can't work effectively, and it will lead to absenteeism. Increased employee engagements. So the better focus on their well-being, the more engaged they will be. These are other reports or review from other organizations, Deloitte, Willis Towers, Gallup, and then SHRM article. The financial impacts, these are, healthy choices have financial impacts for the organization. PwC said their research suggests that employers who provide robust well-being programs can achieve significant cost savings in healthcare expenses and are more productive workforce, ultimately benefiting the company's bottom line. The more productive the workforce, there's more savings in terms of healthcare because of the wellness programs you have engaged them with. Our own unique offerings, customer-centric, technology, health awareness, value-added services. We have these various services that we offer. And Hallmark HMO is a subsidiary of a group which is Consolidated Hallmark Holdings. We have insurance, we have general insurance, we have micro insurance, and we have Hallmark Finance. These are services that we offer. In conclusion, I would plead with you in HR that you should champion employee well-being beyond the handbook, beyond the policy. Make it a course as a crucial element in your organizational strategy and your decision-making. You need to present well-being initiatives, not just as ethical practices. Just like I said, it's not just about ticking the box, but as essential strategies that enhance retention, engagement, and overall performance. With analysis of corporate and individual staff experiences, having health insurance should not be an option. It should be a must-do for best practice. As HR, you should also design and execute programs and policies that have a direct impact on employee well-being. Initiatives such as health and wellness programs, flexible work arrangements, mental health days, and actions that cultivate a supportive and inclusive work culture. And check-ins, even when they are working from home, you must have regular check-ins with them. You must be able to give them a feeling of support. How are you doing? How are you coping? You know, engagement, communicating with them. The culture of the organization must support inclusion for people dealing with one health challenge or the other. I have personal experiences of people that we had to work through. I had two cases. One ended positively, the other one did not. And the only difference was openness and ability to trust the organization to work with those people. One did not trust us, did not communicate on time, and it became fatal. The other one was the mitigation helped, and the person came out of that health challenge. These are health challenges that could have led to death, but was recovered. You know, the person was redeemed because he trusted the system to help the person through. So there are different health needs that people have. You must be able to embrace people whenever they are working for you. You've had some values with them working in your organization. So if nothing else for that, be there to support them. Thank you very much.
Thank you so much. Very fantastic presentation. You will know that this is presentation from leadership. It's almost like you are speaking for the entire HMO community and trying to preempt, and you also demonstrated you understand a lot of the concerns and some of the feedback to individual HMOs across the board. Ladies and gentlemen, so that we are safe, please, we are going to take questions and contributions. But please, I want to beg you, don't mention any HMO in particular. As in, please, well, maybe you can mention Allmark because she's here. But don't mention any other HMO because it won't be fair to call out an HMO that they are not here to either respond or provide their side of the story. You understand, please. But you can still say a certain HMO. Please, let's be circumspect. All right. Already, I dropped 4 questions. And we can take more questions. Then if you want to ask your questions via voice, you can raise your virtual hand and we will respond to you. Meanwhile, let me just read some of the questions we have already, and you can respond in any particular order to the questions. One question here says that, under what conditions is it good to have more than one HMO manage your organization? And what are the pros and cons? Maybe some organizations are very large, or in quotes, in the name of providing alternatives and choices. But we would like you to enlighten us, under what condition is it good to have more than one HMO manage our organization? What are the pros and cons? Another question here is it better to pay HMO premium annually or quarterly? Is it better to pay annually or quarterly? And another question we have here, can individuals as a person, can Oluyemi Adeosun as a person come to, for example, Allmark HMO and say, I want to sign up a plan, either for me, for my family, or maybe I have a house help or a nanny, or I have 2 aged parents. Is it possible for an individual, not the organization, now to come and subscribe, or maybe to say, oh, our church men's fellowship want to subscribe for HMO or HR mentorship, we want to subscribe? Are those kind of things possible? Last question here from here is, do HMOs provide access to tertiary health and institutions, for example, in Lagos, LASUT, LUTH, Ibadan, UCH, and are there conditions or circumstances that may warrant that, or it is completely out of scope? So I will leave those 4 questions and I'll continue to track if you have more questions. Over to you, ma'am.
Thank you very much. So thank you to all. I'm trying to read the chats now just to see the comments and all that. So for the first one, for HMO, for your organization to have more than one HMO, you should have a large number of workforce. While in HR, the organization had about 200 employees, and we had more than one HMO. It helps with competition. It helps to put the HMO on top of their game because they know that they are being compared with another HMO. Okay, so even for a staff strength of 200 in different locations, so you at times find out that some HMOs are stronger in the south, some are strong in the north, and what that means is that their partnership with hospitals are better in those places where they are strong, where they have more staff. So you may, because of that, say, okay, because of our staff in the north, let's have a HMO A, and then for Lagos, let's have HMO B. But it's possible that I prefer that HMO because the hospital I want to use, they have it on their plan. And, you know, my level, my benefits, or rather my plan can access it. So because of that, I'm having relationship with them, you know. There are some HMOs that have hospital partnerships, so to say, or ownerships, and they use that as a leverage for their services with companies. So a client may prefer that HMO because of that hospital, and that no matter the plan, I can access it. Then because of that, that's why I want it. But we are currently working with organizations that have multiple HMOs, and we are competing, and we've been on the plans, I mean, the clients' books for about 3-4 years. And every year we have conversations, we review. The other HMO too have conversation and review. In fact, there was an organization that called all of us together and the HMOs, and we were like 5, just to review rates, to say, okay, we know things are getting more expensive, so let's discuss. Whatever percentage you agree, all of you go and work with it. It happens a lot, even in insurance, that you co-manage a risk because you have different capacities. So collaboration is beautiful in HMO, and it can work. Is it better to pay HMO premium annually or quarterly? For us at HMO, it's better to collect our money annually. Pay us everything. But we know that for us to be customer friendly and understand that your businesses also, you know, especially for companies that are managing clients on behalf of other organizations, they would rather pay quarterly. What we have also introduced is that when you are paying before, if you're not paying annually, there are some services that we peg your access so that you don't have the situation whereby by the end of the quarter, you decide to exit, even though you are not supposed to exit. And then we've already given you access to a bucket of plans, benefits, and then we are the one that will lose at the end of the day. Can individuals approach HMOs to obtain a plan for themselves? Yes. Yes. We have retail plans that individuals can buy. The only thing with retail plan is that we must review your health conditions. So there's an underwriting form that we give you to fill, which helps us to know whether you are okay in terms of billing you for a normal retail plan, or we have to add other premiums for treating some existing conditions. And yes, you can buy for nannies, you can buy for groups. We deal with associations, we deal with cooperatives, we deal with market women, you know, in communities. We will just identify one provider within that area for you all to use, especially when they are all within the same age bracket, you know. So, and we don't also only sell generic plans, we sell customized plans, meaning that I'm at that age, I don't need a maternity, I don't need this. Give me a plan that is for so and so level, and then we cost it for you and we give it to you. Do HMOs provide access to tertiary hospitals? Yes, there are some tertiary hospitals that are friendly with HMOs. There are some, but not all, because their systems are not as fast as private hospitals that can, we have the technology. You're supposed to send your, get your approvals via our platform. We have a mobile app. We are supposed to upload your plans, your tariffs on that platform, so that when you are approving bills, when you are submitting your claims, you are using the software, so that when we start to make payments, it's also faster. But for tertiary institutions, they don't have that technology to do that. Thank you.
All right, thank you so much for those responses. we have two more questions here, or three. Let me look for one of them. All right, so there's a question here, and the question is, what do you do when some employees insist that they don't want to be part of any HMO, that rather you should just pay them their maybe medical allowance?
They don't have a choice. You should not give them that option. But for senior management staff, I work with some organizations who will tell you that at certain level is their medical allowance at that level. And I mean, for that level, it's not going to be cheap. So, and I even have people within that level who will pay for the premium themselves, and collect the balance of their medical allowance. But for those who would want to take their healthcare needs off the organization, I don't trust you, I don't want you, maybe it's possible to look at the specific issue that the person is dealing with. But if the person is not at that high level yet, they cannot dictate to the organization. Otherwise, then you don't have a structure, no policy. People can decide what they want, and that doesn't help anybody.
Okay, the person also said that this is the first time the company is opting to subscribe to any HMO plan. So I think there's this resistance and change management.
Yeah, it's resistance. So communication, a lot of communication, a lot of, HMOs need to come, talk to them, let them understand why HMO is needed, and then allay their fears. Whatever it is that they are getting in terms of medical allowance, that money, they can use it to whatever the premium the organization wants to pay. There must be a reason why they're moving them to the HMO. Budget reasons, constraints, or whatever, or to give them more benefits. So they should look at it from that angle. Whatever that hospital that you have been using, that you already have relationship with, look for where it is in that plan and just continue your relationship with them. And if there are things that they'll tell you, HMO said they are not covering this, use your balance of medical allowance to pay for it. At the end of the day, it's a win-win. It's win-win for you, it's win-win for the organization.
Okay, we have another question here, and the question is, would you advise an organization to go through a broker rather than to go to the HMO directly? What are the pros and cons? Another question here, what preventive services and support do HMO provide for enrollees? In other words, not waiting for them to fall sick, maybe reaching out to them directly or through the HR.
Okay, thank you very much. It's the company's choice to work with brokers. We also work with brokers. We have agents. We have companies that specialize in, being an intermediary between HMO and the organizations. It doesn't matter. The most important thing is that they are considering your own interests and coming up with advisory services that you cannot do directly by yourself. I know a particular organization that have maybe about 40 staff in HR, and about 50% of those staff are managing HMOs. Or managing hospitals directly. So it's like an in-house HMO within themselves. Do you understand? So, and you have situations whereby you outsource it to a broker who gets rates from different HMOs and relates with you based on that. So it's strictly on your choice. It's not necessarily that one is better than the other. It depends on what works for you and your size of the organization. Some is policy. This is our policy. We work with brokers for all our insurances, and because of that, we give it. I said we're a member of a group. That's Consolidated Holdings. Consolidated Hallmark Insurance Limited works very well with brokers, very, very well with brokers, and brokers bring businesses, they relate with them. We also engage with their own brokers on businesses. So it's not, there's nothing wrong with it. It's just for efficiency and what works for you, Preventive services. What preventive services does HMO run? So we do a lot of health talks. But the best thing that every organization needs to have is annual medicals for their staff, especially for 40 years and above. I know that we all have group life, that's compulsory. And part of the requirement for group life, I think every 3 years or so, they conduct medical examinations. But before then, it is better that if you have people over 40, you do annual medicals for them. When people join your organizations, make sure that you conduct what is called pre-employment medicals. All these services we also provide. Now, what that does for you is that you already have an idea of the person's at least basic health conditions or basic health bill, how the person is. This person is healthy, this one is not healthy, this one has this disease, that one has that. You know from the word go, so you know what you are dealing with. But for those who do not have any, or they're already in the system, the best way to have preventive is to do medicals for them. I have been a beneficiary of that. Annual medicals helped me to discover that I had fibroid. From fibroid, I discovered I had endometriosis, and then I needed to do surgery. If I didn't do those tests then, who knows, maybe it would have led to other things. And for some, it could help them to discover that, oh, I'm actually hypertensive. And before you know it, you treat the hypertension, you are fine. Or you start, they place you on drugs, diabetes and all that. So it helps you to discover things before it gets out of hand. But for those who already have one health challenge or the other, the only preventive is to ensure that they are maintaining a healthy lifestyle. And HMOs help to support that by providing gym services, by helping them to see specialists that will help them to manage their health needs, and regular, checks. When we come to your office for health talks, we come with our basic health checks that we also do. Do you know that even from those small checks, like checking BP, checking BMI, and blood sugar, we discover things that people didn't know about. So those things have to be done regularly, at least every 6 months. You should have your HMOs come in to talk to you about a health condition. People ask questions, people deal, relate with them one-on-one. People have access to materials that they can read on different things, and then do those checks for them. So those are the ways I think that we can help our enrollees. And those are the things that we do, which has helped.
Okay, thank you so much. I have 2 more questions from my end here, but I'm trying to check. Okay, let me read the question from Udeme. Udeme says, we currently use the services of a certain HMO. They don't offer health supplements, e.g. vitamin C and the likes. Is this a general practice? I am of the opinion that in catering to the well-being health of employees, the HMO should not be relinquished to sickness only, but preventive services.
Okay, so the reason why supplements are not covered is because, Udeme, you may not mind getting vitamin C of 300 naira. But Oladotun, I don't use this kind of vitamin C. It must be the 5,000 naira one. So, and most times, hospitals, sorry if you are working in an hospital, I'm not deliberately trying to, but the higher the cost, the better for them. So you find out that they will be picking the most expensive. So it's a general rule across HMOs that supplements are not approved. They are not allowed unless the person is antenatal and that supplement is part of what they normally would give. But another thing is that you are treating malaria and they give you multivitamin. No, you're not supposed to take multivitamin when you're treating malaria. So HMO will not approve it. As I said before, when I was doing my presentation, I said it's an health insurance policy. It cannot cover everything. And if you are being fair to them, if you pay them a premium of 50,000 naira, 2 visits for outpatients, that would have covered your premium. The only reason why they are still in business is that is the law of large numbers. Everybody will not go at the same time. So if they give you prescription for some things and they tell you that this is not covered, I pay for it myself, or I buy it myself, because it's my health, first of all, beyond the HMO, covering everything.
Thank you so much, Ma, for your response to that question. I have more questions here. And this one is very interesting.
Yeah.
And the question is, how do you handle issues with patients who use alternative medicine or who combine alternative medicine with traditional medicine? Then what really happened? All this wider typhoid, it is not typhoid, it is typhoid, it is malaria and typhoid. Maybe you want to share some exposure. Another question I will ask, maybe I should join it, even though it may be close to the alternative medicine. How do you also deal with patients who use faith, FAITH, who use faith, and sometimes some of them either discontinue the usage of some of their routine drugs. People who are hypertensive, diabetes. I'm asking these questions intentionally because it's important people learn how it happens. When you manage a very large workforce, there's nothing under the sun that you will not see.
That you will not
Over
see,
to you,
yes.
Yeah.
Yeah. So I've had the experience with this alternative medicine. Even before HMO, organizations do not work with traditional medicine. And it's very simple. It's the same thing of risk that you cannot measure, and there is no regulation or regulation that is widely accepted, uniformity that we cannot say. If they give you your bottle of agbo, the components of it is not stated on it, or the side effects and all that. So it may work with you, and it may not work with another person. So that's why alternative medicine is still not part of formal medical sciences. And that's why even for the HMO, we have regulation and we work with our regulator, and this is part of it. It is not covered. It is not something we can cover. I've had experience of people with orthopedic cases who will tell you, sorry, I have done the medical one, I want to do the trado. Are you going to support me financially? We say, no, sorry, we cannot. That's as HR, we cannot. You're on your own. Go and sort yourself out. Some get better, some get worse because of the different peculiarities involved in it. Now, for the wider tests, the typhoid or no typhoid. Well, I'm not a doctor, but I know that, a lot of times we self-medicate. We know our body and we say, these are the symptoms I'm having. So because of that, it's typhoid. So even when you get to the hospital and the doctor, when you make your complaint and he just tells you to do normal malaria test, you are angry. You are telling him, I say I have typhoid. You are not doing typhoid test. Well, your symptoms does not support it. And that typhoid is not something that is a disease. It's not something that you just use anti-malaria to treat. You will be on admission, you will take drip. The major problem we have when it comes to malaria and typhoid issue is resistance to the drugs. We've overused the drugs, we've abused the drugs, it's not working. And what that means is that we need to, first of all, look for how to, flush our systems from those drugs that we've overused. Stress is the main thing, honestly. I have discovered, after working from home, after COVID and all that, I don't take anti-malaria like I used to, because now I see that it's stress. It's not even malaria. It's stress that I'm having. So if I sleep well, if I drink a lot of water and I exercise, I'll be fine. I don't even take Panadol like, one used to take it before. because you realize that those things are actually more harmful than, good for your system. Just be packing drugs. So that's my own, advice when it comes to those things. Don't become the doctor. Let the doctor do his work by advising you what you should do in terms of tests. And then when they give you the drugs, use it as prescribed. When you're taking anti-malaria, you're not supposed to take fruits. But some of us don't know that. You are taking multivitamin, you are taking fruits, you are not resting, you are not taking fluids, and you want the malaria to, it won't work now. And then you go back again, cycle repeats itself. So it's just basic health awareness that we all need so that we know how to deal with some of these things.
Thank you so much. I'm happy to announce that we have the final question for tonight, except anybody wants to raise their hand and speak.
Somebody raised a hand before, but I can't remember who. But I saw a hand that was raised before. Maybe the person decided to.
Ginika, if your hands are up, I've made you a co-host. You can unmute and speak. I think I saw, but I wasn't sure whether it was hands to ask questions or thumbs up for a beautiful response or a beautiful presentation. So the question is from elected council member. Madam, you saw her yesterday. You'll have asked her the question now.
I saw her yesterday.
She's not asking you virtually today, but it's okay. So she's asking here that, well done, man. Thank you for your presentation. If my company cannot afford both NHIA and HMO at the same time, which ones should you advise we go for first? That's our question.
Your budgets.
Wow. It appears our network is frozen, or could it be my network? Can we hear her, please? Let's drop a message in the chat box if you can hear her or hear me.
I think it's a network, ECM, sir.
Okay. Thank you so much, because I just noticed that from my end here, our screen is frozen. The last statement I heard from her was that it's your budget.
Yes, that was
the determinants.
Yes, that was what I heard from her too.
Okay. All right. She has been taken off completely. All right. I actually think it's a very convenient point and spot to wrap up this presentation. I think she's back, and I'm happy.
I'm back.
All right. You can wrap up your response and comment.
Thank you so much. So I was saying that it depends on you, it depends on your budget, but look at the limitations of the one you want to buy. Let that guide you. What's the limitation of this one? Because I know and you know that each of them has their limitations. Talk to people who are already using that particular, whether it's NHIA, LASHMA, or whatever. Talk to people who are using it and what are their complaints, and use that to take your decision of whether buying a private or a government plan. And I don't even think that you will need to buy both. That, as I said before, LASHMA, Ministry of Health in Lagos, and healthcare practitioners, HMOs, are having a collaboration in terms of coming up with a plan on how to work it out so that you don't need to pay for both. It's either or. That's what we are looking at. And we know that it will work out as we planned.
Thank you so much, Ma.
Thank you for having
can't thank
me.
you enough. We can't thank you enough. On behalf of every single person who joined us tonight, we'd like to celebrate you, we'd like to appreciate you, and pray that God will continue to bless you, protect you, and guide you. Thank you so much for your vulnerability tonight. I felt touched that you could share that level of personal detail. But again,
sorry, there was one question I didn't answer, the one of faith. When it comes to issue
please. Yes.
Yes. When it comes to issue of faith, you really cannot, you have to be very careful. as an HR, as an HMO, you know, as people dealing with human beings, because my belief is my belief and it's my reality. It's my reality. So it's more of moral suasion. Okay, but why don't you? What of this? You know, you have people that want to take, want to do a surgery and they say they will do blood transfusion. They say, no, we don't do it. And they will insist that they will not do it. So we'll join them in their faith and pray that it works out for them. But you don't force, you cannot force people because, I mean, when it comes to their health, they must take their decision. I think as HRs, we need to understand that. You cannot force people to take the decision for their health. You will advise and then you will support them. So thank you very much
And
for
where
having me.
necessary, where necessary, get them to sign an undertaking that they are the one that turns down.
Exactly. In fact, a beautiful memo to say that refer to our conversation, blah, 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 and this is what you
Yes.
agreed, opted to
Yes,
do.
so that the family will not come
And-
back and sue you.
That is just
Okay.
it.
Ginika's hand is now up and she has the floor. Ginika, you can unmute and speak.
Good evening, sir. Good evening, ma. That was quite, I really enjoyed this section and we want to say thank you. Thank you so much for your time. And thank you also for this personal narration you shared. It's not easy to be vulnerable in the public, and so we appreciate that. I wanted to ask a question, but when I remember this section was recorded, I pulled down my hand. But again, I also remembered you said something about faith. So I just said, okay, let me just chip in what I want to say. So I have two questions, which is one. I'm currently, we are not calling names, right? So in 2022, I got employed. And luckily, when I got employed, the HMO my company was using had my hospital in it. And I was so happy, I was so excited because I know Cedar Crest Hospital is expensive, but I used Cedar Crest for a certain reason. I was a one-time survivor of a ghastly motor accident that took away 14 passengers, leaving me the only survivor. And I was in coma for almost 8 months, going to 9 months. I was blind for almost a year, and I was facing amputation of my 2 legs and my 1 hand. Fast forward all that, I spent almost 2.5 years in the hospital, or getting to 3, I can't remember. So, to the glory of God, I can see now just that I have issues with light, and if for any reason I read too much, I become stressed out. It's my eyes is what suffers the most. But I've not had any complication. I have not taken paracetamol since 2019. I'm not taking Panadol. There's a whole lot. And I'm not one that fall ill. I've not gone to the hospital for any reason. It's just my eyes, right? So I want to so currently now, like back to what I was trying to say. So when I got employed, this particular HMO my company used was having Cedar Crest. Unfortunately, sometime in December 2022, Cedar Crest was removed from the plan I can access. So I've been spending money on my health from my personal purse. So sometime 2 weeks ago, I emailed the HMO asking why is Cedar Crest not here. They said, okay, Cedar Crest was moved to Uber, whatever, a different plan altogether that my own plan paid for cannot access. And I'm like, okay, that's fine. Let me add, after all, this past 2 years, I've been spending a whole lot of money for my personal. So let me add to it and pay. And this HMO is now telling me choosing a different hospital in Abuja I should go. And I'm like, I do not want to go there. This is the hospital in Abuja I feel comfortable with. And they're insisting I go to a particular hospital they want. So I don't know if there's a particular collabo or they are promoting that hospital. I don't know.
With your own HR, have you leveled this up with your organization to let them understand this particular issue?
Well,
I'm sure
to be very sincere, I've not really done that like that. because I'm HR though, but I've not taken it to the next level. In fact, at the point, I'm like, okay, you know what? Remove my name from the HMO because it's waste of money. They are paying a HMO plan I will never access. I can't go to another hospital. Going to another hospital is exposing myself to the whole MRI scan, the whole brain scan, the whole everything. Is a whole lot of process. And I'm not sure it's easy to track or to maintain doctors or surgeons who was there all along. That's starting the whole thing afresh altogether.
Yeah, I get you. I get you. So what I will advise is to engage with you. You are an HR, so I mean, you should be able to, level up with your management. This this is my history. You know, when I was talking, I mentioned it that HR needs to understand the peculiarity of people's needs. In your own case, Cedar Crest is not just an hospital. They have your history, peculiar history. And psychologically, you feel safe there. You would not definitely feel safe elsewhere. So there is an emotional aspect to it beyond the health need. And you need to let your management know this is the current problem you're having. Now, if this HMO says that I don't have any partnership with Cedar Crest again, you, Ginika, should go to Cedar Crest and have a conversation with the management of Cedar Crest. What's happening with this HMO? Why are you not partnering with them? This is this HMO my organization is using, and I need to have you guys on back on that HMO. You should be able to use your influence as HR to do this. So you are trying two things. You are conversing with the hospital, and you are also conversing with your own organization. If the HMO is not giving you the real reason why they are not putting Cedar Crest up as an option for you, take it to the hospital themselves to know. You should have a relationship with the hospital now, and then your organization, so that you can get what you need. This is the need. It's not a luxury. You know, there are some people who just want hospital for the sake of the name. I want this hospital because of this name. In that case, you're on your own. But in your own peculiar case, the issue goes beyond just the hospital. And I know Cedar Crest is expensive. It's not a load plan hospital at all. But as I said, there are exceptions to every rule.
Okay, thank you so much, Ma. Thank you. I actually went to Cedar Crest Management December 2022 when I saw that if the HMO had been removed from there, and I asked them, they told me, there is because of price issues, but they are working towards it, right? And finally, I was like, okay. So thank you, Ma. I will take the other option you suggested, and I hope let me see how it goes, because mentally I'm like, okay, they should just remove my name from the HMO because it's waste of my employer's money paying for every year, and I'm not able to.
Leadership by example. You can't be in HR, you are not on the list, and you're telling your staff, everybody will opt out. If I work in your organization, I'll be the first person to opt out. HR is not there again. Okay, me too, I don't want. Take your
Okay,
and then
all
the
right,
policy.
Ma. Thank you, Ma. Thank you so
All right,
much.
then. Thank you.
Thank you, Ma. All right.
I'm particularly glad we had this session tonight. I must thank Mrs. Ola Dotun. You see, sometimes we never know what we do for each other. If not, for example, for your level and measure of vulnerability, this particular clarification or question will not have taken place. And sometimes too, that's why I also encourage people as much as possible, as much as practicable, join the live session. If you watch the recording, there will be no way to have this two-way conversation. It's not as if you can't book an appointment. You can, and she will give you, but it is when you, and for lack of a better word, there is also anointing in the air at time. And I'm happy you've been able to get some feedback. I think we have to come to a hard stop now. I tried not to exceed 90 minutes so that all of us will not call in sick tomorrow and burn our HMO, what do you call it now, premium. Again, we'd like to thank you so much, ma'am, for your magnanimity, your generosity, and your charity. I pray again that God will continue to bless you and your organization. She has already displayed copiously her contact details. If you want to reach her for business, I encourage you to please feel free. Maybe you can ask for HR mentorship discounts. You never know what can work. That's on a lighter note anyway. Ladies and gentlemen, good night. Let's have a productive week. Bye, everyone.
Bye, everyone. Have a wonderful week.